Most people think kidney disease is something that happens suddenly. One day you're fine, the next you're told you need dialysis. But that's almost never how it actually plays out. Kidney disease is almost always a quiet fade, especially after 60. Your kidneys start working a little less efficiently, your body makes tiny adjustments, and you feel fine. You might notice you're getting up to pee more at night, or you're a little more tired than you used to be, but you chalk it up to aging. Then one day a doctor glances at your lab results and says, "We need to talk about your kidney function." If that's happened to you, or if you're worried it might, this video is going to walk you through exactly what's happening in your body, why your kidneys are more vulnerable after 60, and most importantly, what you can actually do about it, starting today. Emotional introduction, 30 to 40 seconds. The tricky thing about kidneys is that you can ignore them for decades. They're small, they're tucked behind your ribs, and they don't send up obvious distress signals the way your heart does. But they're also some of the hardest working organs in your body. Every single day, your kidneys filter your entire blood supply dozens of times over. They clean out waste, they balance your electrolytes, they regulate your blood pressure, and they produce hormones that tell your bones to stay strong and your body to make red blood cells. When your kidneys are working well, you never think about them. When they're not, everything starts to slow down. And here's what matters most for anyone over 60. Your kidneys will work differently than they did when you were 40. That's not a disease yet, that's aging. But understanding the difference between normal aging and actual disease is what lets you stay ahead of it. Your kidneys are made up of about 1 million tiny filtering units called nephrons. Each nephron has a glomerulus. That's the part that acts like a net, catching waste and extra fluid, and a tubule, which is the part that reabsorbs the good stuff your body needs and gets rid of the rest. Over a lifetime, you naturally lose nephrons. You're born with more than you'll ever need, which is why you can lose a lot of kidney function and still feel completely normal. But after 60, the rate of that loss picks up. Here's where most people don't know the full picture. It's not just that you lose nephrons. The nephrons that remain also work differently. The blood vessels in your kidneys become stiffer. The tubules become less efficient at reabsorbing salt and water. Your kidneys become more sensitive to dehydration and to certain medications, and your body's ability to regulate electrolytes and fluid balance gets more sluggish. All of this happens gradually, and most of it is completely silent. That's actually important to understand because it changes how you should think about your aging kidneys. Your kidneys aren't broken when you're 65. They're adapting to an aging body. Your body as a whole is also changing. Your heart is pumping a little less forcefully. Your blood vessels are stiffer. Your digestive system is moving things more slowly. Your kidneys have to keep working in that context. So when doctors measure kidney function using something called the glomerular filtration rate, or GFR, they find that the normal GFR for a healthy 80-year-old is actually lower than the normal GFR for a healthy 40-year-old. The surprising part is, and this is where it gets interesting, a lot of people get diagnosed with kidney disease simply because they're aging normally. That's why it's so important to talk to your nephrologist or primary care doctor about what your specific numbers mean, not just whether they're high or low. There's one detail most people miss when they think about aging kidneys. Your kidney function loss is not automatic. Some people at 70 have almost the same kidney function they had at 50. Others have lost a lot more. The difference comes down to your genetics, your overall health, what medications you're on, and what happens in the next few sections we're going to cover. Section 2. Warning signs. Your doctor might miss, and what you should never ignore. 30 minutes. Okay, so your kidneys are aging. How do you know if that's normal aging or if something's actually wrong? Most kidney disease doesn't announce itself with dramatic symptoms, but there are patterns you can notice, especially if you know what to look for. The first one is changes in how much you urinate, particularly at night. If you're getting up 3, 4, 5 times a night to use the bathroom, and that's new for you. Now, a lot of things can cause that. Diabetes, urinary tract issues, a smaller bladder capacity as you age. But declining kidney function is also on the list. Your kidneys aren't concentrating your urine as well anymore, so your body holds on to less fluid and sends more to your bladder. That usually means you pee more often and in larger volumes. The opposite pattern can also happen. Some people with declining kidney function actually retain fluid because their kidneys aren't getting rid of excess water. That shows up differently. You might notice your ankles swelling by the end of the day, or you put on your rings and they feel tighter, or your shoes are snugger. You might even gain several pounds in just a week or two because your body's holding on to extra fluid. Here's where it gets interesting. Fatigue is incredibly common in people with declining kidney function, and most of them never make the connection. Your kidneys produce a hormone called erythropoietin, or EPO. When your kidneys are working well, they produce the right amount of EPO to tell your bone marrow, make enough red blood cells. Red blood cells carry oxygen. When kidney function declines, EPO production drops, and you end up with fewer red blood cells. That's anemia. And anemia feels like exhaustion. When kidney function declines, EPO production drops, and you might not want to go for your normal walk or garden like you used to. People chalk this up to aging, and sometimes it is just aging, but it's worth mentioning to your doctor, especially if it came on gradually. Another sign to watch for is blood in your urine, or foamy urine. Foamy urine can mean your kidneys are losing protein in your urine. Normally, your kidneys keep proteins in your blood where they belong. If your kidneys are damaged or stressed, they can start leaking protein. You'll notice your urine looks foamy or bubbly. That's always worth investigating. Get a urinalysis. High blood pressure damages your kidneys over time, and declining kidney function raises your blood pressure. So if you've had good control of your blood pressure for years and suddenly you're struggling to keep it down, that's a signal to get your kidneys checked. And finally, nausea or loss of appetite. When your kidneys aren't filtering waste well, the waste builds up in your blood, and that can make you feel nauseated or just generally unwell. You might not want to eat your favorite foods. You might feel an unusual metallic taste in your mouth. This symptom usually only shows up when kidney disease is more advanced, but it's important to know. Almost nobody realizes that these symptoms can be so subtle and easy to blame on other things. That's why regular lab work matters. A simple blood test can measure your creatinine level and calculate your GFR. A urinalysis can check for protein. If you're over 60, especially if you have diabetes or high blood pressure, ask your doctor about getting these tests done if you haven't had them recently. Section 3. The risk factors that matter most after 60. 4:30 to 5. Diabetes is the #1 cause of kidney disease in the United States. If you have diabetes or if you've had prediabetes for years, your blood sugar levels over time have been damaging the tiny blood vessels in your kidneys. That damage is cumulative. The good news is that keeping your blood sugar in range, if you have diabetes, is one of the most powerful things you can do to slow kidney decline. So if you've been a little loose with your diabetes management, this is the moment to talk to your doctor about tightening it up. High blood pressure is the second biggest culprit. High blood pressure damages the small blood vessels in your kidneys, and once those vessels are damaged, your kidneys can't filter properly. And like I mentioned, it's bidirectional. Bad kidneys make your blood pressure worse, which makes your kidneys worse. If your blood pressure is consistently above 130/80, especially if you're over 60, you and your doctor need to take that seriously. If you have heart disease or a history of heart attack or stroke, your kidneys are at higher risk. Your kidneys need good blood flow to work properly. If your heart isn't pumping as effectively, or if your blood vessels have atherosclerosis, your kidneys don't get the blood flow they need. This is why people with heart disease and people with kidney disease so often go together. Obesity puts stress on your kidneys. Extra weight increases inflammation throughout your body and puts pressure on your kidneys to filter more. If you've been overweight for decades, your kidneys have been working harder than they should be. Certain medications that are very common in older adults can stress your kidneys over time. NSAIDs, that's ibuprofen and naproxen, the common pain relievers, can damage kidney function if you're taking them regularly for years. ACE inhibitors and ARIBs, which treat high blood pressure, are actually protective for your kidneys in most cases, but they need to be monitored. And some other medications for other conditions can affect kidney function. This isn't a reason to stop taking medication. It's a reason to make sure your doctor knows what you're taking and is monitoring your kidney function. Autoimmune diseases like lupus or rheumatoid arthritis can affect your kidneys directly. Chronic kidney disease in your family history is a red flag. Kidney disease can run in families, and if one of your parents developed it, your risk is higher. Smoking damages blood vessels all over your body, including in your kidneys. If you're still smoking, quitting is one of the most protective things you can do for your kidney health. There's one detail most people miss. Age itself is a risk factor, but only because of the other things that stack up over time. It's with a 70-year-old without diabetes, without high blood pressure, without heart disease, and without obesity might have completely normal kidney function. But that's unusual. Most 70-year-olds have at least one or two of these risk factors, so their kidneys are working a little harder. Section 4. What actually prevents kidney disease and what doesn't? 5 to 30 minutes. Here's the best part of this whole conversation. A lot of what protects your kidneys is stuff you can actually control. This isn't about radical life changes. It's about the fundamentals that matter. First, blood pressure control. If you have high blood pressure, getting it down to below 130/80 is one of the most protective things you can do for your kidneys. Your doctor might recommend medication, and if they do, taking it consistently matters more than whether it's a specific type. It's the control that matters. Second, blood sugar control if you have diabetes. If you've been diagnosed with diabetes, managing it well, keeping your A1C down, not letting your blood sugar spike wildly, is directly protective for your kidneys. If you haven't been diagnosed yet, but have prediabetes or are at risk, preventing progression to diabetes is huge. Third, staying hydrated. Your kidneys need water to filter properly, but hydration doesn't mean you should drink 3 gallons a day. It means steady, consistent fluid intake throughout the day. For most people, that's around 8 glasses a day, maybe a little more if you exercise or live in a hot climate. The best sign you're hydrated is that your urine is light yellow, not dark. But here's what's important. If you have heart failure or kidney disease already, you might need to limit fluids, so talk to your doctor about your specific needs. Fourth, maintaining a healthy weight. You don't have to be thin, but if you're significantly overweight, losing even 10 or 15 pounds can reduce the stress on your kidneys and lower your blood pressure. This is about the metabolic weight your body is carrying, not about appearance. Fifth, eating a kidney-friendly diet. You've probably heard about low-sodium diets for blood pressure, and that applies here too. Limiting salt to less than 2,300 milligrams a day helps your kidneys and your blood pressure. If your kidney function has already declined, you might need to watch potassium and phosphorus too, because your kidneys can't regulate those as well. But if your kidney function is still good, just maintaining the basic healthy diet, vegetables, fruits, lean protein, whole grains, limited processed food, is what matters. If you've been taking ibuprofen or naproxen regularly for years, talk to your doctor about alternatives. Acetaminophen is generally safer for your kidneys. Physical therapy, gentle movement, and managing inflammation through diet can reduce your need for pain relievers. Seventh, avoiding smoking. If you smoke, quitting is profoundly protective. If you don't smoke, not starting is one of the best decisions you can make. Eighth, moderate exercise. You don't need to train for a marathon. A 30-minute walk most days of the week, or swimming, or any moderate activity that gets your heart rate up a bit, improves your overall cardiovascular health, which includes your kidney health. Exercise also helps you maintain weight, lower blood pressure, and improve blood sugar control, all protective. Ninth, managing stress. Chronic stress raises your blood pressure and inflammation. Finding ways to calm your nervous system, meditation, time in nature, hobbies you enjoy, isn't just about feeling better. It actually protects your kidney function. Almost nobody realizes how much these factors add up together. One person who controls their blood pressure, doesn't have diabetes, stays at a healthy weight, exercises, and doesn't smoke will have dramatically different kidney outcomes at 80 than someone who has all of those risk factors. And the surprising part is, you don't have to do all of these at once. Pick one or two that feel most doable for you, get those going, and then add another. Small, consistent changes compound. If you're over 60 and you're thinking, it's too late to change anything, that's not true. Your kidneys benefit from better care starting today. Section 5. Living well with your kidneys. Staying ahead after diagnosis. 4:30 to 5. Stage 1 is GFR 90 or higher, which is normal. Stage 2 is 60 to 89, which is mild kidney function decline, usually without any symptoms, just seen on lab work. Stage 3 is split into 3A, 45-59, and 3B, 30-44, and this is where people usually first get the diagnosis. Stage 4 is 15 to 29, and Stage 5 is below 15, which is kidney failure and means dialysis or transplant. The vast majority of people diagnosed with Stage 3 kidney disease never progress to kidney failure. Your primary care doctor can manage Stage 3 kidney disease, but a nephrologist will help you slow the progression and adjust your care as things change. You'll probably be monitored more regularly. That usually means blood work every 3 to 6 months instead of annually. Your doctor will check your creatinine and GFR, and they might check your urine protein levels. That's not about being paranoid, it's about early intervention. If they catch your kidney function starting to decline faster, they can adjust your medications or your diet to slow it down. Your medications that protect your kidneys are ACE inhibitors or ARBs. If you're not on one of those, ask your doctor if it's appropriate for you. If your kidney function is low, you might need to adjust doses of other medications or avoid certain ones altogether. This is where having a nephrologist is really valuable. They know which medications are safe and which need to be avoided or dosed differently. Your diet might become more important. If your kidney function has declined to stage 3B or beyond, you might need to limit potassium, found in bananas, potatoes, tomatoes, orange juice, phosphorus in dairy, nuts, processed foods, and sodium. But this depends on your specific numbers, so work with a dietitian who specializes in kidney disease. Here's something people often don't realize. Once you have a diagnosis of kidney disease, even stage 3, you shouldn't take new medications, even over-the-counter ones, without checking with your doctor or pharmacist first. NSAIDs are off limits. Some supplements aren't safe. Your kidney status changes what's appropriate. The big thing, though, is this. Having stage 3 chronic kidney disease does not mean you're heading toward dialysis. It means you need to be intentional about the fundamentals we talked about in Section 4. Blood pressure, blood sugar, weight, diet, hydration, avoiding harmful medications, and exercise. All of those matter even more now, and they can actually slow or stop your progression. You should also be screened for other conditions that go along with kidney disease. Your doctor might check your blood pressure more often, screen for cardiovascular disease, and check your bone health, because kidneys are involved in calcium and phosphorus regulation and bone strength. You'll probably get an annual eye exam if you have diabetes, because both your eyes and kidneys are affected by diabetes in similar ways. It all connects. And here's where it gets interesting. If you're monitored and managed well, you might have decades of life ahead with stage 3 kidney disease. You can travel, you can work, you can do the things you enjoy. The thing most people miss is that your mindset matters. If you get a diagnosis and go into panic mode, that stress actually makes things worse. If you get a diagnosis and you respond by taking action, getting a specialist, adjusting your diet, starting to exercise, managing your stress, you're actually slowing the disease. You have agency here. Closing and call to action, 40-50 seconds. So here's what you should take away from this. Kidney disease after 60 is real and increasingly common, but it's also largely preventable and manageable if you catch it early. The risk factors that matter most are diabetes, high blood pressure, heart disease, obesity, and certain medications. And the things that protect your kidneys, managing blood pressure and blood sugar, staying hydrated, maintaining a healthy weight, eating well, exercising, and avoiding smoking, are the same things that make you healthier overall. If you haven't had your kidney function checked recently and you're over 60, especially if you have diabetes or high blood pressure, talk to your doctor about getting a simple blood test and urinalysis. It takes 15 minutes and could catch something early. Please leave a comment below and let me know, have you been diagnosed with kidney disease, or is kidney health something you've been worried about? I read the comments and I love hearing from you. And if this video was helpful, subscribe to the channel. I make videos about health and aging every week, and I'd love to have you as part of this community. Taking care of your kidneys is one of the smartest things you can do for yourself in the second half of your life. It's not too late to start, and it's always a good time to do better.